പാഞ്ഞ് ലോകം മാറി വേലി ചാടി വളപ്പ് മാറി തേടി ചാഞ്ഞ തോടി ചാടി മെയ്യറിഞ്ഞ് കാലറിഞ്ഞ് ഞാനകന്ന പാത മാറി കാലിലായ ചോടി മണ്ണ് തട്ടി മാറ്റി ഞാൻ അലഞ്ഞ് മാറി കാറ പൊള്ളി മൂർച്ച കയറി ചിന്തയൊന്നൊരുണ്ണമൊന്ന് വന്നണഞ്ഞ് മുന്നിൽ നിന്ന് വെക്കപ്പിന്റെ മോനത്തേക്ക് മൂഷിലായി കോളിംഗ് ആയി ഫക്ക് മെനി ain't stuck with any South in the kishak guy scope kakkanariyilla naipena naipu.
A very good morning to everyone and welcome back to the second day of the 2 days national conference. It's tremendous to be in Nagpur, a city that truly represents the spirits of progress. As the sun rises over the Nagpur skyline, may this conference inspire us to reach for the new heights, explore bold ideas, and create lasting change. Welcome to the city of every conversation, a step ahead, inside and progress. Good morning and warm welcome to the esteemed guests, distinguished peoples, and valued participants. I am Ms. Pooja Dhenge, Assistant Professor at KC Bajaj College of Pharmacy and Research, Jaripatka, Nagpur. And it is my great honor to welcome you all on the behalf of our college 2 days national conference on the theme Natural to Synthetic, the Convergence of Traditional Medicine to the Modern Medicine, in association with Association of Pharmaceutical Teachers of India APTI and Indian Taxpayer Association ITA, powered by Sundar Biscuit Industries, Ion Enterprises, Asylum Remedies, Chitkara University, Zim Laboratories Limited, Vico Lab, Unizul's Life Sciences Limited, Vipani Herbals, Sophie Bags, and Lakshmi Pustakalaya. So again I welcome back you all to the second day of 2 days national conference hosted by the KC Bajaj College of Pharmacy and Research, Jaripatka, Nagpur. We hope you had fruitful and inspiring day yesterday, and we are excited to continue this incredible journey of knowledge sharing and collaboration. So now we are moving towards the plenary session. Now I would like to respect Principal Dr. Mohammad Tokir Sheikh Sir and our resource person Dr. Brijesh Taksande Sir, along with our chairpersons for the Dr. Nitin Dumore Sir and Dr. Geeta Lodhi Ma'am, Principal Taiwade College of Pharmacy, Nagpur, to kindly occupy the dais. Please sir, please ma'am. Now I would like to invite Dr. Nitin Dumore Sir to please felicitate Dr. Brijesh Taksande Sir with floral bouquet, shawl and shriffle. Now, I would like to invite our Principal Dr. Mohammad Tokir Sheikh Sir to please felicitate Dr. Nitin Dumore Sir. Again, I would like to invite our Principal Dr. Mohammad Tokir Sheikh Sir to please felicitate Dr. Geeta Lodhi Ma'am, Principal Taiwade College of Pharmacy, Nagpur. Thank you, sir. Nothing great will be achieved without great men, and great men are only if they determine to do so. It's not every day to get the chance to learn from someone with such a distinguished career, and we are thrilled to have them with today. Let's commence our next session by acknowledging the remarkable contributions of Dr. Brijesh Taksande Sir. Currently, Dr. Brijesh Taksande Sir is a Professor, Dean Research and Accreditation at Srimati Kishori Tai Bhoyer College of Pharmacy, Kamti, with overall experience of 22 years. He particularly in preclinical screening of CNS drugs, advanced research methods like immunocytochemistry, and intracerebroventricular drug administration in rodents. Dr. Taksande sir has published 132 research articles in high-impact international journals, earning numerous awards and patents. He has completed 500 research projects, totaling 2.5 crores, supported by the organization like Indian Council of Medical Research, ICMR, All India Council of Technical Education, AICTE, Department of Science and Technology, DST, and Rashtra Sant Tukadoji Maharaj Nagpur University, RTMN. Dr. Taksande sir has played key role in the development of Institute Srimati Kishori Tai Bhoyer College of Pharmacy, Kamti, contributing to its 75 rankings in India for last 8 years. Dr. Taksande influential research focus on the neurotransmitter agmatine and its role in neuropsychiatric, neurodegenerative diseases, metabolic disorders, and drug abuse. For his significant contributions to neuroscience, he received the Best Research and Scientist Award from the Rashtra Sant Tukadoji Maharaj Nagpur University. Sir, we humbly invite you to enlighten us with your knowledge and insight. So today, Dr. Taksande sir will be discussing on behavioral ontology and developmental trajectories in autism, pathways to therapeutic innovation through exercise-based intervention. I'm sure you will find this session very informative and both aspiring. So let's give a warm welcome to Dr. Brijesh Taksande sir. I would now request to Dr. Taksande sir to please start the session. Please, sir.
Hello. Okay, so good morning, everyone. Good morning, everyone. Okay, now it is better. So, in the beginning, I must congratulate Dr. Mohammed Tawqir for organizing such a beautiful conference at a beautiful campus. I must be thanking the management of KC Bajaj College of Pharmacy and Research for this courageous step. Why I am calling this as a courageous step? Because this college is in the second year of its inception, right? So just 2 years, and they are organizing a national conference at a national level. This is the big achievement, and you must be proud about your principal for this courageous step. Not only he organized, but he maintained that decorum to bring the people of a national repute and to have their interaction with you so that it can inspire, it can motivate, even it can sensitize the brain of young pharmacists for research and development. So thank you very much, management and principal. To begin with the permission of Honorable Chairman and Vice Person of today's session, Dr. Nitin Dumore and Dr. Geeta Lodi, I just want to start this session with very humble note. This is a conference which is bringing the traditional medicine to the synthetic medicine, and then you're talking about what are the modernization of the medicine, right? So I thought, why not to combine our traditional lifestyle, the lifestyle which is given by us by Ayurveda. So lifestyle which is given to us by Ayurveda, and to translate it to the translational outcome to therapeutic intervention using this lifestyle modification, right? So in next 45 minutes, we'll be discussing what lifestyle modification in today's era would be required so that we can prevent, rather we can treat the diseases of central nervous system, right? So to begin with, this is the photograph or picture you can clearly see or observe from the beginning of history itself, from the beginning of mankind itself. People or the brainy people or intelligent people are trying to make our life easier. Easier in the sense that it is sedentary, it is less workload, and to live it very happily, right? So we have discovered, first and most important discovery of mankind is a discovery of fire, then discovery of whales, and followed by the discovery of many other component which is associated with making the life of the patient, life of the person on the easier track, right? So what we learn from our history, that mankind itself is trying very hard to make our life easy, right? When we look at the discovery of medicine in late 17th century, there was a discovery of vaccine first, and this vaccine discovery led to the development of prevention as well as treatment of various infectious diseases, and it increases the survival of humankind. You can see from this graph the life expectancy, which was only 35 years in the beginning of 1700, now reaches to almost 84 years. So on an average, a single person have a longevity of more than 84 years in today's area, right? So we have enhanced it from 32 to 84 years. Almost we have increases our survival by 50 years. Credit almost goes to all the inventions, the medicines which are available, maybe it's serendipity discovery of penicillins, maybe discovery of various antibiotics by which we led our humankind to survival, and we are now living on an average up to 84 years. But while the course of this development, in the progression of this development, we have also made our life easier by taking the innovations into the practice. And you can see from this, there is a discovery of bullock cart, there is a discovery of plane, there is a discovery of train, and then buses. So the human beings which were walking on the roads, which were walking on the streets, are reluctant to do that, and ultimately it is resulting into the workload based or workload driven lifestyle to the entertainment driven lifestyle. Ultimately what happened, most of our time has been saved, and this time has been utilized in the involvement of sedentary lifestyle. This sedentary lifestyle or inactive physical state can be of anything. For example, you can sit here without doing anything, you can watch TV without doing anything, you can talk on the phones while sitting, you can commute in the transportation without doing any activity. So what this has resulted in? This has resulted in the development of the first and most important metabolic complication, that is obesity. And this obesity later on converted into various CNS complications, and ultimately resulting into brain disorders, neurological disorders, and ultimately mood disorder. So in nutshell, while making our life easier, comfortable, we have made our life obese, we have made our people obese, sedentary, ultimately associated with several disorders. And nowadays we are facing the problem which are associated with this sedentary or inactive physical life, right? This is the graph where I want to point out that why this is important. This is the data which I have collected from Lancet Neurology, published in 2021, and it clearly states 34% of the total global population is suffering from either one or two neurological disorder. It can be anything. It can be on the threshold of depression, it can be anxiety, it can be psychiatric disturbances, or it can be dementia, it can be Alzheimer, it can be epilepsy, it can be any CNS disorder by which we can suffer by in our lifetime, right? If you combine the first three compartments, for example, Alzheimer and dementia, depression and anxiety, they altogether constitute more than 40% of the total neuropsychiatric complication by which any human can suffer from at this given time. And this is the most important problem because it is not only associated with health complication but has also created the economic burden on the society. $3 trillion have been spent associated with 9 million deaths in 2021 resulting out of this neuropsychiatric complication, and that's why it is necessary to pay the attention in the prevention as well as in the treatment of neuropsychiatric disorders, may it be depression, may it be anxiety, may it be Alzheimer associated dementia. What are the routine pharmacological treatments available? Okay, we know that there is a tremendous burden, tremendous economical burden. There are many deaths taking place because of these neuropsychiatric complications. There are many suicides taking place. There are many asylums full of the patients suffering from schizophrenia and psychosis. What we offer, what are the treatment options available for their therapeutic intervention? You can see from this slide that most of the therapeutic interventions are directed towards the neurotransmitter modulation. We know there are several neurotransmitter systems working in the brain, and we just modulate it. For example, we know there is a decline in the serotonin, norepinephrine level during the course of depression, and most of the antidepressant drugs are increasing it or enhancing it, right? Otherwise, ion channels, for example, sodium channel blockers, potassium channel blockers are widely used in the therapeutic interventions of epilepsy. There are neuroprotective, there are anti-inflammatory drugs are routinely prescribed for the therapeutic intervention of chronic neurological conditions like Alzheimer's disease, right? Apart from this, there is a cognitive and behavioral therapy. You must have heard about the counseling, which is very routine in the neuropsychiatric disorders intervention. And apart from this, dialectal behavioral therapy, exposure therapy, and there are some surgical interventions, mostly the surgical interventions which involve deep brain stimulation in the Parkinson's diseases, and electroconvulsions and neurosurgical interventions which are associated with therapeutic outcome in the neurodegenerative disorders like Parkinsonism and Alzheimer are routinely practices in the therapeutic interventions of mood and neurological conditions. But what are the drawbacks? Is there any drawback? Is there any limitations when we talk about the current pharmacotherapy or current neuropsychiatry or neuropharmacology? Yes. Most of them are only working at the symptomatic level. There is no cure of depression, there is no cure of Alzheimer, there is no cure of Parkinsonism. These are progressive diseases, right? So only there is a symptomatic relief. We know for sure that there is a dementia associated with Alzheimer. We only prevent or only treat the depression, only treat the dementia associated with Alzheimer disease, but we can't treat the progression of a disease. Apart from this, there are various side effects. For example, you may be surprised to know that fluoxetine, which is routinely antidepressant drug, routinely used antidepressant drug, are having the high chances for the induction of suicide behavior, right? Apart from this, there is a chance of obesity when you shift the patient on antipsychotic therapy. So antipsychotic drugs are tremendously used as a psychiatric medication, but rather it is associated with obesity, and that leads to neuropsychiatric complication altogether. Other non-specific targeting, for example, in most of the cases we do not know what is the exact cause or pathogenesis for the particular neurodegenerative disorders, and this would ultimately associated with a non-therapeutic target binding of a drug, ultimately associated with a binding to many other receptor and altogether associated with many complications or many other side effects. Other complications which is associated with psychiatric complications is a relapse or resistance. This is very clear that resistance is only associated with antibiotic. We know antibiotic associated resistance. But if you use the therapy for a depression for a prolonged period of a time, it is also associated with a treatment resistant depression. If you taking the therapy for a anticonvulsant or taking a therapy for a seizures or a convulsions, one fine day patient may have a treatment resistant epilepsy. So resistance and tolerance, these are the altogether coming problem where you can't treat the patient who are suffering from a treatment resistant depression or treatment resistant epilepsy. Apart from this, there is a tolerance which is very common with the benzodiazepine, the drugs which are used for the treatment of anxiety or post-traumatic stress disorders. So there is a need for effective therapeutic intervention and looking this therapeutic intervention from different point of view, right? We have seen the therapy by modulating the neurotransmitter system. We have developed a therapy by modulating a neuroprotective mechanism. We have developed a therapy by taking the help of neuroinflammatory pathway, but still there is no absolute therapeutic intervention. There is no absolute cure for the disorders by which our brains are suffering, by which our central nervous systems are suffering, and that's why there is a urgent need for a new therapeutic strategy for the therapeutic intervention, so that at least we can prevent, we can modulate, or we can reverse the condition of our brain, of our deteriorating brain, or we can reverse the condition by which we are suffering from. Okay. So when we look into the depth, or when we look into the causative factor, why there is a 32% neuropsychiatric complication or 32% total global populations are suffering from, the most important causative factor nowadays is to be or is considered as a sedentary behavior or physical inactivity, right? This physical inactivity or sedentary behavior can be any phenomena where you don't generate energy which is more than the resting state of your total energy consumption. For example, if your total energy consumption at resting state is 1 kilocalorie per kg per hour, and if you are not consuming that much of energy at any given activity or at any given time point, it would be considered as a physical inactivity, or it can be considered as a sedentary lifestyle. So this can be like very common in the generation. This can be observed in all the ages of the life. For example, it can be defined as you can see, using a computer, sitting at a school or a work, or sitting while commuting, during transportation, or just sitting as it is before TV, enjoying our lifestyle, eating anything without doing any physical activity or without getting involved into the physical exercise. All these activities considered to be the sedentary lifestyle, and it is one of the most important contributing factor for the genesis or etiopathogenesis of CNS disorder. Next most important factor is a disturbed sleep wake up cycle, right? So as you are aware, we need 8 hours per day sleep, right? If there is a disturbances, for example, if we watch TV before sleeping, if we take a mobile in hand before sleeping, if we use a computer, it will automatically reflect the action or activity in the central nervous system. There is activation of central nervous system. There is a decrease in the melatonin concentration, and ultimately it would be associated with the disturbances in the wake up cycle. This is one of the reason for the development as well as etopathogenesis of different neurological complications. Next most important complication or contributing factor is a drug addiction. Drug addiction, which is constitute as more than 12% in Indian population and equivalent to 1% in Indian female population, is contributing to the larger extent for the development of neuropsychiatric complication. Apart from this, diet, fast food, processed food, and food which is containing MSG, what we called as a Ajinomoto or monosodium glutamate. So fast food, processed food which is having a preservative like propionic acid, or anything, any Chinese food which is having a high content of monosodium glutamate, is also associated with the development of a neuropsychiatric complication. Apart from this, stress, especially chronic stress, is altogether the most important reason for a development of a neuropsychiatric complication. And then dysbiosis. This is something new. Dysbiosis is a condition where you can consider there is a disturbances of your friendly bacteria and there is an increase in the negative bacteria or a harmful bacteria. So there are three types of dysbiosis. In first, there is a decrease in the diversity of the bacteria. Like for example, our GI tract harbor trillions of the bacteria, and when there is a reduction in this diversity, it is considered as a primary dysbiosis. Second dysbiosis can be considered as a reduction in the friendly bacteria. For example, lactobacillus. If there is a reduction in the lactobacillus, it can be considered as a secondary dysbiosis. If it is associated with a increase in the harmful bacteria like E. coli, it can be considered as a tertiary dysbiosis, and all these conditions associated with a dysregulation of a gut-brain axis communication, ultimately the metabolic product of a harmful bacteria entered into the blood circulation. This blood circulation, they entered into the blood-brain barrier, entered your brain, may be associated with initial neuroinflammatory responses, associated with secondary neuroinflammatory pathway activation, finally associated with a neurodegeneration and accumulation of different proteins, peptides in the brain, may be associated with a neurological or CNS complications. So these are all lifestyle modifications. We know everything about it, but we do not know what harm is actually made by this lifestyle modification to our body, to our physiology, and largely to our brain. In next few slides, we'll discuss what is the science behind the modification of this lifestyle, and ultimately how we can prevent, how we can treat, how we can reverse the conditions which are associated with this lifestyle modification in next 30 minutes. If you search on the internet, there are many surveys, more than 250 surveys have been carried out just to gather the information what could be the consequences on the brain circuitry if anybody is indulged in inactive behavior, if anybody is indulged in a sedentary lifestyle. Out of this 250 survey which are carried out at America, at European countries, at China and all the other continents, they have came out with a clear-cut conclusion that when the people are involved in inactive behavior or inactive physical state, maybe sedentary behavior, at a normal routine period, normal routine time, it is usually associated with a dementia, cognitive decline, and mild cognitive impairment in their lifetime. So you may be at any age, you may be of any religion, you may be of any country. If you are not involved in a physical activity, if you are not active in a life, ultimately there are high chances in your coming days, maybe after age of 50 or 55, there are high chances that it would be associated with mild cognitive impairment and cognitive decline in your lifetime. Ultimately, it would be associated with Alzheimer, right? So it is not only associated with obesity or metabolic complication, but also associated with neuropsychiatric complications, and dementia is the most prominent out of it. So this is very important point I just want to highlight. There are some blue zones. You must have heard about it, that these blue zones are the specific regions in the globe at a universal level, and it is found that the people who are resident of these blue zones are usually live longer as compared to normal global population. You can find the number of colonies or number of people having aged more than 100, resident of blue zones and living their life happily. It is observed that when they talk with them, when they actually carried out the survey, when they interact with them, they found that these people who are the resident of a blue zone actually associated with some very unique behavioral pattern. Throughout their lifespan, they were physically active. First and most important thing. Throughout their lifespan, they were physically active. And most of them were totally dependent on the Mediterranean diet. The diet which composed of high levels of vegetables, fruits, without consumption of red meat, right? And they were highly social. So these were the three critical observations of the study carried out at the blue zones, where residents were living at the age more than 100, and they found that they were typically involved in the physical activity. They were totally dependent on the Mediterranean diet, mostly combined of fruits, vegetables, less meat, high fish and other protein in their diet, and they were social animals. They were involved in altogether social activity, right? This is most important observation which has led to the observation or declaration by WHO, World Health Organization, that one should get involved in the physical activities so that it will not only prolong the life of the people, but also it will be associated with prevention of many neuropsychiatric and metabolic complications. So why this is taking place? So there is a clear-cut distribution in the pathway. If you look at the upper line, which is associated with active lifestyle, there is a neuroprotective mechanism activated. This neuroprotective mechanism is associated with one very critical component of a brain, that is called as a brain-derived neurotrophic factor. It is actually associated with the strengthening of a glia, a supporting cells of a neuron. It is also associated with a synaptic plasticity, and in a longer run, it will be associated with a neuroprotection, which is preventing any neurodegenerative changes which is taking place during the course of a time. If you look at the downline, when the aging is taking place, but the people are not in the active state, or they are in the sedentary or inactive or less physical activity, it is associated with a accumulation of a beta amyloid. This is a protein which is get accumulated into the different neurons of the brain circuitry, and they actually get accumulated to such an extent that neurons can't communicate with one another. The beta amyloid can be considered as a plastic type material which is preventing the neuron to neuron, cell to cell communication and associated with a neurodegenerative changes. Maybe in a later life, the patient would be suffering from Alzheimer or Parkinsonism or any other neurodegenerative diseases like Huntington disease. So there is a clear-cut pathway which are differentiating between active life stages and inactive life stages. If you are active, Neuroprotection will be taking care of your brain. If you are inactive, there would be a beta amyloid, and it would be associated with a neurodegenerative changes, and it would be associated with some neurological complications in a later life. Then coming to the exercise or physical activity, why this is important and how much it is important, right? So there are many reluctancy, there are many objections. We don't have time. My life is such that I will not get any time for exercise. I can't involve in exercise because I'm living in a very sophisticated area where there is no space. There can be n number of reasons. There can be n number of arguments for not doing a physical activity. But in the upcoming slide, we'll discuss, rather we'll interact why physical exercise has become the integral part in the prevention as well as in the treatment of a neurological complication. Why one should get involved in a physical activity or exercise so that we can prevent at least some behavioral changes, at least some neurological changes, at least we can regulate our mood so that our life become easier. There are two types of exercise. Now please don't judge me by this presentation. शायद आपको ये लग रहा होगा कि ये आदमी तो लगता नहीं कभी जिम गया होगा. शायद आप लोग ये सोच रहे होंगे तो सर ने कभी कोई स्पोर्ट्स ही खेला नहीं होगा, या सर कभी फिजिकल एक्टिविटी में इन्वॉल्व हुए ऐसा लग नहीं रहा होगा, राइट? This is scientific presentation and I admit it. I am not that passionate about gym. I only play volleyball, table tennis to a short extent. But after COVID-19, I have changed my lifestyle in a such a way that it is having that incorporation of at least 20 minutes physical activity, maybe voluntarily or involuntarily. So that doesn't make any change, whether you are doing it by your will or you are doing it by essentiality or by compulsion, right? So what WHO has recommended, there is only 150 minutes physical activity required per week to maintain the healthy lifestyle. If you divide this 150 minutes on the daily basis, precisely it becomes 21.4 seconds. 21.4 seconds. Now you tell me, out of 24 hours, if you can't take out 21 minutes for your own health, what we are going to provide to our next generation, right? See, मैं हमेशा अपने स्टूडेंट को बोलता हूँ कि लाइक हमारे मम्मी पापा की सिर्फ ज़मीन या जायदाद ही हमको नहीं मिलने वाली. उन्होंने जो फ्लैट खरीदा है या उन्होंने जो गाड़ी खरीदी है वही हमको नहीं मिलने वाली. बट वी आर ऑल्सो इनहेरिटिंग देयर जेनेटिक्स. We are also inheriting their DNA, right? We are active, like maybe of my age. I don't see anybody of my age. 50 years, we have that close observation कि हमने हमारे माँ बाप को कभी जिम जाते हुए नहीं देखा. I am proud to say this. I called my mother as a pharmacist of a world because she treat everything with झंडू बाम. कुछ भी हो जाए वो सिर्फ झंडू बाम यूज करती है. rather than going to doctor, taking a medicine, she use झंडू बाम and treat it. So either it is headache or stomach ache or anything. अच्छा नहीं लग रहा है झंडू बाम अप्लाई करो ठीक हो जाएगा. But she is very resistant to take a medicine, right? So I have never seen my father going to gym, my mother working in very physical activity, but I have not observed my mother watching TV continuously for hours and hours. मैंने कभी अपनी माँ को टीवी के साथ घंटों बिताए हुए भी नहीं देखा. मैंने मेरे पापा को कभी जिम जाते हुए नहीं देखा, पर मैंने देखा है कि मेरे पापा या हम लोग के पापा जो 50 साल की उम्र में आज, उन सब के पापा ने साइकिल चलाई है और 60 साल तक 70 साल तक साइकिल चलाई है. सो साइकिलिंग इज़ अ वेरी गुड aerobic exercise and that has ultimately resulted into their strong DNA, ultimately resulting into our strong DNA, right? बहुत ज़्यादा कॉम्प्लिकेटेड करने की ज़रूरत नहीं है. उमेकर सर को आप सब लोग जानते होंगे. उन्होंने एक बहुत ही वाइज डिसीजन हमारे साथ शेयर किया. वो एक नैक इंस्पेक्शन पे थे. उनके जो चेयरमैन थे, नैक इंस्पेक्टर, ही हैपन टू बी द वाइस चांसलर ऑफ वन यूनिवर्सिटी, एंड बहुत ही फिट एंड फाइन लग रहे थे एकदम एट द एज ऑफ 65 और 64. तो उमेकर सर ने उसको पूछा कि सर आप क्या करते हैं ऐसा कि इतना फिट एंड फाइन लग रहा है. तो हिज आंसर इज़ वेरी सिंपल, राइट, वेरी इंटरेस्टिंग. उन्होंने ये बोला कि मैंने मेरे लाइफ में सिर्फ नीचे करके, गर्दन नीचे करके मेरा बेल्ट चेक किया है. इफ आई कैन सी माई बेल्ट इन अ स्ट्रेट वे without any hindrance, I am fit and fine in my life. He was just talking about the abdominal obesity or belly fat obesity, right? Belly fat obesity is a typical beginning of unhealthy lifestyle and can be considered as a triggering factor, not only for metabolic complications but also affecting brain severely. सो सिर्फ अपन लोगों ने क्या करना है, नीचे देखना है और चेक करना है अपना बेल्ट बराबर दिख रहा है कि नहीं दिख रहा है, राइट. दैट इज ओनली द मोटो. जस्ट गेट इन्वॉल्व इन अ 21 मिनट टिपिकल रेगुलर एक्सरसाइज, वेरी वाइजली रिकमेंडेड बाय WHO, 1000 स्टेप पर डे, 1000 स्टेप पर डे, एंड इट विल बी सफिशिएंट टू प्रिवेंट यू or your family from any health related complications. So there are two type of exercise. One is resistance exercise and second is endurance exercise. Endurance exercise, when you have a minimum resistance, minimum opposition, and you can do it for a prolonged period of a time. For example, running, walking, swimming, cycling. These are all the examples of a endurance exercise which is providing a strengthening to your lungs. Actually it is associated with the aerobic respiration, and it will be making your lungs very confident, very strong, so that you can handle any stress confidently. Second is a resistant exercise, where for a limited period of a time you are working against any load, right? So if you are going to gym, you are picking up a load, you are resistant exercising, employing your legs, they are associated with a resistance exercise, and it will be providing a strength to your muscle. तो आप देखोगे कि जो जिम में जा रहे लोग जो रेजिस्टेंट एक्सरसाइज में इन्वॉल्व है उनकी बॉडी बन रही है, बट जो एरोबिक एक्सरसाइज में उनकी बॉडी नहीं बन रही है, बट वो लोग भी बहुत ही फिट एंड फाइन है, राइट. सो दिस इज एसोसिएटेड विथ both the exercise, evidently associated with the maintenance of your normal brain circuitry. It is associated with a regulation of your mood. It is preventing brain from any psychiatric complications like depression, anxiety, psychosis, or any other neuropsychiatric complications like schizophrenia. But in a long run, it is providing the protection against the neurodegenerative complications like Alzheimer, Parkinsonism, Huntington disease, multiple sclerosis, brain injuries, and other cerebrovascular complications like stroke. So stroke is one of the most important lethal component associated with a death as well as permanent disability of the patient, can be prevented just by exercise of 21 minutes per day, 1000 steps per day, getting involved in a physical activity, or maybe by your will or maybe by essentiality, right? There are typical examples by which scientists have proven the capacity of physical exercise in the prevention as well as in the reversal of some of the symptoms of Alzheimer's disease. As I told you earlier, dementia is a first and most important symptom associated with Alzheimer's disease. It can be easily prevented by a regular exercise. It is associated with many neurotransmitter, neuropeptide changes in our body. One of the most important neuropeptide which is releases after exercise is the BDNF. And this BDNF is actually providing the synaptic plasticity, offering a neuroprotection to the neurodegenerating brain and preventing you from the dementia and mild cognitive impairment associated with Alzheimer's disease, right? So physical exercise regularly can prevent the occurrence of Alzheimer, but it also can reverse some of the symptoms of Alzheimer's disease, most importantly dementia if person is suffering from Alzheimer. Psychosis, which is associated with depression, which is associated with increase in anxiety, decrease in BDNF level, and then decrease in HP axis regulation, can be associated with induction of a diseases. The most important parameter here is a regulation of a microbiota. Whenever there is a induction by maybe a post-traumatic stress disorder or early adversity, which is one of the component of a psychiatric disorder, if it has been there, it will be mostly affecting your gut microbiota, may be associated with a depression, anxiety, reduction in a BDNF level, can be associated with a neuropsychiatric complication, but can easily overcome by a regular exercise or by getting involved in a natural sports. So you need not be involved in a exercise, even if you involved for a limited period of a time in a game in which you are interested in, maybe badminton, maybe running, maybe bicycle running. Anything can prevent your brain from the psychiatric complication induced or associated with a stress. Depression has been evidently proven to be reversed by the lifestyle modification or by exercise. Here the most important component which is observable or which are evident by the scientific publications or by scientific evidence is that during the course of exercise there is a reduction of a cortisol, this stress hormone which is ultimately associated with a progression as well as maintenance of a depression, and by exercise you can reverse the release of a cortisol, you can decrease the release of a cortisol. So this cortisol, which is a villain in the occurrence or the progression of a depression, can be prevented, can be inhibited or prohibited just by getting involved in a physical activity, right? So it is associated with a genetic modification, may be associated with a regulation of a gut microbiota, maybe regulation of a neurotransmitter system, most importantly serotonin, dopamine, norepinephrine, and all together when you point out the final outcome, it is associated with a regulation of your mood, and ultimately you can prevent as well as you can treat the patient suffering from a depression. You will be surprised to know that when they have compared the actual antidepressant therapy to that of exercise has proven to be more effective as compared to antidepressant therapy. Rather, antidepressant therapy will be having some side effect. As I told you in the beginning, फ्लूऑक्सेटिन जो एंटीडिप्रेसेंट है, जो मूड ठीक करता है, अगर लॉन्ग रन में लिया गया तो पेशेंट सुसाइड करते हैं. सुसाइडल टेंडेंसीज आर वेरी हाई in a patient who are taking fluoxetine for a continuous or for a prolonged period of a time. So by exercise you can have this better effect, you can prevent the complications associated with a antidepressant therapy. The most important outcome of the exercise has been observed in the autism. This autism has been increasing with the alarming speed. It has been detected, diagnosed in the 1% of the population, maybe by 10 years back. but now it has reaches to 2.5% of a population in 2024. Autism, which was considered to be the genetically ordered disorder maybe 10 years or 15 years back, now it is considered as one of the most critical outcome of a environmental dysregulation. For example, if female during their pregnancy get exposed to viral infection, if females get exposed to the natural preservatives or synthetic preservative in their diet like propionic acid, if they consume anti-epileptic drug like valproic acid during their pregnancy, there are high chances that the resultant outcome would be associated with autism, right? So autism, nobody knows why it is taking place, what is the exact pathogenesis for the autism, but it is associated with severe mental retardation and there is no cure. So ultimately you have to deal with the patient's life, you have to deal with the family's life, and ultimately you have to take care of the patient for their lifelong, right? It is observed that there are 3 types of exercises. If during pregnancy there is an exercise, it is associated with a less chances or minimum chances of autism in the pregnancy outcome. So if pregnant ladies are associated with even minimum exercise, minimum physical activity, there are minimum chances that the babies would be born having autistic trait. Even if they are diagnosed with the autism after their birth, and if you expose these babies, their offsprings, to a physical exercise or with physical activity, you can reverse some of the cognitive damages which have been taken place during the course of autistic progression. So you can increases their cognition, you can increases their psychiatric behavior, you can increases their intellectual ability if you expose them to early phase of their life to the physical activity. Even if they are exposed to a late life to the physical activity or exercise, it can be associated with a prevention of some deteriorating changes that would be very obvious if the patient is suffering from autism. So there are 3 types of the exercise or physical activity recommended. One, for the prevention. If one is exposed to a viral infection or environmental toxin like propionic acid or valproic acid as a medication, and if you involve in or indulge in a physical activity or exercise, you can minimize the chances of autistic outcome. During the early phase of a life, if you involve or expose them to the physical activity or exercise, you can reverse the damage which has already been taken place, and certainly by exposing them to the exercise in a due course of a time when they become adult, you can prevent the further deterioration of their brain, further deterioration of their central nervous system. So what are the health benefit of physical activity? Certainly it can reduce the chances of a dementia by 30%. Now this is very well proven. It is very well accepted by scientific community. A person who is involved in a regular physical activity, his or her intellectual capability would be much more as compared to the person who is involved in a sedentary or inactive lifestyle, right? It can decreases the mortality by all causes, by all chances, by all diseases by 30%, right? It can also reduces the depression by 30%. It can reduces the chances of hip fracture or accidental fracture by 68%. Certainly it can be associated with prevention of a cardiovascular complication, some type of a cancer, most importantly colon cancers and stomach cancers can be easily prevented by getting involved in a regular exercise. Apart from this, type 2 diabetes mellitus or metabolic complications which is spreading at an alarming rate can be prevented or even can be treated by a regular exercise. So you can highlight these many benefits by just getting involved in a regular exercise. Now, what are the molecular pathways which are actually responsible for this benefit of exercise? Now, this is very important because this is actually the soul of our presentation. We are here not only to discuss what are the benefits of exercise. You can Google it, you can watch any video, you can just search on the internet, you will find the multiple benefits of a physical exercise or getting involved in a physical activities. But we are here as a pharmacist, as a researcher, as a postgraduate student, also as a research scholar, how we can modify this exercise driven pathway for a therapeutic intervention of a new drug molecule, or how we can accelerate the drug discovery processes, drug discovery in a CNS complication by taking the help of this pathway which are actually activated by a physical exercise. So there are 4 molecular mechanisms which are activated by a physical exercise. It may be a aerobic exercise, it may be a resistant exercise, it may be a normal physical activity, but getting involved in a physical activity and not getting involved in a sedentary lifestyle will be activating a 4 critical molecular pathway which can be targeted for the drug discovery process, which can be associated with a therapeutic intervention in a drug development for a CNS, various CNS disorder. So extreme left, you can see there is a capsaicin pathway. It is also called as a CAT pathway. CAT pathway. This particular molecule, which is called as a peptide, ultimately getting releases in the blood circulation, releases from the muscle, get entered into the blood circulation and has got free entry through blood-brain barrier, can reaches to the brain circuitry. This is the wonderful molecule because most of the CNS acting drug face this problem that they cannot penetrate the brain sufficiently because of the blood-brain barrier. Now I am suggesting you a one peptide, one neuromolecule which is called as a cathepsin B. This is also called as a CAD-B, which can just releases after the exercise get entered into the blood circulation, can easily crosses the blood-brain barrier. You can target this pathway for a therapeutic intervention of different neurological or mood disorder. Second pathway, which is very common, may be known to you, as we know our muscle use glucose as a source of energy, and after glycolysis or after completion of a tricarboxylic acid, this glucose has been converted to the lactate. So glucose converted to lactate. Now the beauty of this lactate is that once it get entered into the blood circulation, it can easily crosses the blood-brain barrier through a penetration, through a allowing protein, and by going into the brain, it can activate several neurotransmitter, neuromolecule or neuromodulatory system which can be providing a therapeutic benefit to the neurological complication. Third and most important pathway where our lab is interested is the pathway of irisin. Actually, there is a protein which is associated with the skeletal muscle. This is called as a PPR alpha protein, which is actually the significant driving factor for the conversion of this FGC1A to FNDC5, and from FNDC5 there is a conversion or there is a synthesis of this myokine. This myokine on irisin has got many diversified role in the central nervous system. It has got role in the periphery. It has again got role in the central nervous system because it can easily crosses the blood-brain barrier and can be associated with final pathway or can activate the final pathway, which is referred as a pathway of brain-derived neurotrophic factor. So all these three pathway come together for the activation of this BDNF pathway. You can see at the end of this graphical presentation, there is an activation of a BDNF pathway. So CAT-B, lactate and irisin all together will be coming to one conclusion, that is activation of a BDNF pathway, and BDNF by acting on its TRK receptor will be providing you the actual benefit of exercise. Will be providing you a actual benefit of a exercise. There is one more fourth pathway. This is called as a Ken-urenine pathway. This Ken-urenine is a typical molecule which is releases after exercise, and it has got tendency to get transferred to the blood-brain barrier, but it is providing some complications because this Ken-urine is going to be convert into the quinolonic acid, and this quinolonic acid is a neurodegenerative molecule which is actually associated with several neurodegenerative disorder, right? So if we could convert this Ken-urine into a quinurine acetate, it will not be going to the blood-brain barrier, and this can be done by your exercise. Exercise actually activating the metabolic enzyme by which Ken-urine would not be going to the brain, rather it is only available in the periphery and not reaching into the brain, so that there would not be any neurodegenerative complications associated with a life. So there are four pathways. First, I'm repeating this: CAT-B, lactate, irisin, all together are associated with the activation of BDNF, and BDNF would be activating their own receptor, providing a neuroprotection, synaptic plasticity, neurotransmitter regulation, neuromodulatory regulation, and may be associated with the regulation of mood, neuroprotection, and prevention of several neurological disorders. This fourth pathway, which is actually associated with a Ken-urine getting liberated, getting entry into the brain, causing a neurodegenerative changes, can be prevented if we get involved in the exercise and converting it into the inactive form, which will be available only in the periphery. Now one more important parameter which is driving factor for a neurological changes associated with a exercise, and this pathway which is driven by the exercise and regulated by a microbiota. As you are well aware that we harbor abundant of a bacteria, almost 10 raised to power 14 number of a bacteria are available in our gut. Just like our earth harbor plants, animals, different species, human beings, bacteria as well, our GI tract harbor diversified bacteria, diversified component, and this diversified component is actually providing you immunity from various neurological complications, right? So when we get involved in an exercise, it has been proven by various findings, various clinical studies, preclinical investigation, that whenever anybody get involved in an exercise, there is a increase in the diversity of the bacteria. There is an increase in the friendly bacteria, there is increase in the number of friendly bacteria, and simultaneously there is a reduction in a harmful bacteria. So bacteria like lactobacillus will be getting enhanced, the bacteria like E. coli will be getting reduces, and it can be done by various pathways. So there can be activation of a vagus nerve that can be associated with HP axis regulation. It can be also associated with a neurotransmitter synthesis. You may be knowing that microbiota or a bacteria actually synthesizing serotonin. They actually synthesize serotonin from a tryptophan. Tryptophan is a raw material, and by taking the help of this raw material, it synthesizes serotonin, and serotonin is a happy hormone. We know it for sure. Serotonin is a happy hormone. So when you involve in an exercise, your bacteria will be synthesizing serotonin from a tryptophan, and it will be providing you a happiness, right? So what else we want, right? But these are the opposite driving factor if you do not exercise. sedentary behavior or inactive behavior actually reduces the diversity. It actually increases the harmful bacteria and can reduces the friendly bacteria, and you can have the severe CNS complication if one is involved in an inactive physical activity. So final hero of the story is a BDNF, right? BDNF, why I'm calling this as a hero of a story, because it is the central component. Any beneficial effect which is associated with the exercise are mediated by BDNF. BDNF has got its own receptor. It is called as a TRK beta receptor. They activate this beta receptor circuitry and ultimately associated with neuroplasticity. It is associated with a molecular mechanism and morphological changes in a various parts of a body. Especially in the brain circuitry, you must have heard about the hippocampus, a small part of your brain which is associated with a learning and memory, right? And learning and memory is totally driven by the BDNF. BDNF is providing a strengthening to hippocampus by several mechanisms, by morphological changes, by synaptic plasticity, and even by a neurotransmitter modulation, so that your short-term memory can be converted into a long-term memory, and ultimately it would be associated with a intellectual ability of a person, right? So this is the most important fascinating aspects of a BDNF, that it actually strengthens the different pathways which are involved in a neuroprotective mechanism which are associated with a mood regulation. Not only hippocampus, whenever there is a release of a BDNF in a prefrontal cortex, it is actually associated with an increase or enhance in a quantity of a BDNF in different parts of a brain. The most importantly, the part of a brain which is associated with anxiety behavior, like amygdala, the part of a brain which is associated with a drug addiction, ventral tegmental area, also shown to have an abundance quantity of a BDNF if it is getting activated in a hippocampus and a prefrontal cortex. Now, what are the villains? What are the negative component of a sedentary lifestyle? In the beginning of a story, I told you there is a beta amyloid, right? Whenever one is physically inactive, one is involved in a sedentary lifestyle, or where your metabolic equivalent is less than 1.5, which is referred as a sedentary behavior, it can be associated with the accumulation of a beta amyloid pathway, right? So beta amyloid is a normal peptide which is available in the body, but it is also associated with a normal physiological process. As you can see from this graph, APP play a very important role in a neuronal development signaling. It is also associated with the intracellular transport and neuronal homeostasis. So precursor molecule of a beta amyloid is actually providing a strengthening to your neurons. It is actually providing a neuronal homeostasis to your brain circuitry, right? So if everything goes in a normal direction, it will not create any problem. But when person is getting or not getting physically active, there is a activation of different pathway which is called as a amyloidogenic pathway, where your APP would be converting into the beta amyloid, and this beta amyloid would be ultimately associated with a accumulation into the different parts of a brain circuitry, blocking their pathway, blocking neuronal communication, and ultimately associated with a neurodegenerative changes in a human circuitry. So this is again the complex neurocircuitry which is activated by a BDNF, rather beta amyloid circuitry. So you can see from the graph there are many molecules, many receptors, many receptorial systems which are activated by a beta amyloid, and this activation of a neurotransmitter or neurocircuitry pathway ultimately associated with a neurodegenerative changes which are associated with a sedentary lifestyle. So ultimately there is activation of tau phosphorylation and may be associated with a progression of a neurodegenerative changes which would be ultimately associated with a Alzheimer disease. Then what exactly sedentary lifestyle doing with us? How it is affecting our body, how it is affecting our brain circuitry, right? You can see from this graph, advancing age, sedentary lifestyle, depression and stress, they actually activate similar pathway, like they are associated with a systemic inflammation, impaired autophagy, vascular dysfunction. It is associated with the accumulation of misfolded protein. There is a mitochondrial and metabolic dysfunction, which is associated with neuronal energy failure, neuronal dysfunction, death, and may be associated in a long run, dementia and Alzheimer disease. So sedentary lifestyle or inactive physical lifestyle are associated with all these molecular changes, can be associated with neuronal damage, neurodegeneration and Alzheimer disease in a due course of a time. Now, what are the recent advancement? We have seen that whenever there is a lack of sleep or sleep dysregulation, it can be associated with the accumulation of a beta amyloid protein in a body, right? So beta amyloid accumulation would be activating the neurodegenerative pathway, may be associated with a neurocognitive decline and may be associated with a Alzheimer disease progression. Dysregulation of neurotransmitter system. This is again very important. Whenever there is a blockade of neurons, the first and most important component which is going to be hampered is the release of a neurotransmitter. And this neurotransmitter decline would be not only associated with a mood regulation, dysregulation of a mood, but also associated with the occurrence of several neuropsychiatric complications. So how we can drive this pathway for the development of a molecule? How we can take these preliminary findings to the translational level, right? As we know, exercise has been associated with a release of several neurotransmitters, several myokines or several exerkines. It is necessary to draw a line where we can regulate their role, we can regulate their pathway. They are available in a brain, they are available in a blood, they are available in a skeletal muscle, but it is a need of our to synthesize them outside the body. It is need to synthesize them outside the body so that we can take a actual benefit of exercise by injecting them, by exposing them to the human body where the actual physical exercise is not possible. For example, the patient who is on the bed for a prolonged period of a time, a patient who is on a chronological diseases or a chronic diseases like tuberculosis or any neuromusculoskeletal disorder where the movements at all is not possible, right? So here we cannot recommend physical exercise. In that case, it is important to note where we can take out this molecule from the body, whether we can synthesize them in our laboratory and whether we can inject them to the people where it is required most. So there are many conditions where it can play a very important role as good as your exercise, right? So it is a important pathway, rather it is a novel pathway where we can target our force, we can drive our force so that one fine day we can have a therapeutic molecule working similarly to that of a physical exercise, behaving in an exactly similar fashion, providing all the benefits of exercise to a people where exercise is not possible. For example, if anybody is involved in a space exploration, right? We know the example of Miss Chawla, where physical exercise or movement at all is not possible. We can take these molecules to the space, expose them to the human body, and we can see whether they can provide the actual benefit of a physical exercise or not. Not only to the physical benefit, but also to the brain circuitry, to the development of a CNS or a not, or for the prevention of a CNS complications or not. So we need to check whether it can be used for the disease prevention. As we know, exercise can be associated with the prevention of diseases, but it is need to be evaluated, it need to be verified whether this molecule when injected from outside will be providing the prevention from a different neuropsychiatric complication. Second, whether this can be associated with a disease therapy. So it is a very, very critical role. For example, whenever we are writing a prescription, we write a name of a medicine, we write a dose, we write a duration. So what could be the prescription if it is having a exercise in a component, right? So it should be verified, it should be titrated, it should be recommended on the basis of a large clinical trial, what quantity, what amount, what duration, what frequency of exercise would be required so that we can have the actual health benefit to the community. Next is, can we create certain exercise mimetics? As you know, irisin is one molecule, lactate is one molecule, cadbay is one molecule, right? Apart from this, there are several neuromolecules which can be activated by exercise. At present, we do not know. So, can we create a library where we can say, yes, this molecule is being created or synthesized in my laboratory, and can it be acting as a exercise mimetic, behaving in the similar fashion to that of a actual physical exercise. Apart from this, there are other dietary modifications or lifestyle modification which can also be targeted for the prevention as well as treatment of a neuropsychiatric complication. I will not take much time, just we have discussed the physical exercise in depth, and most of the benefits of lifestyle intervention or lifestyle modifications are almost equal or almost similar to that of a physical exercise. We'll be just discussing what could be the other alternative pathway, other therapeutic intervention which can be targeted for a CNS drug discovery process. The most important is a dietary intervention, Mediterranean diet, ketogenic diet, anti-inflammatory diet. It is coming as a new concept which can be associated with a prevention as well as treatment of several neurological complications, right? Next is sleep optimization. We all know there is a essentiality of at least 8 hours of a sleep for the maintenance as well as regularization of a different behavioral pattern, different mood regulation of a human body, but it is to be done on the mandatory basis. It is to be done on the essentiality basis so that we can get the actual benefit of a sleep so that it can be associated with a prevention of a CNS diseases. Next is a cognitive and social therapy where we can have the music and art therapy, digital cognitive training, social engagement and learning. Apart from this, mind-body interaction, for example, meditation, mindfulness, breath work, biofeedback, forest therapy, then nutraceutical and functional food, and ultimately microbiome-based intervention, prebiotic, postbiotic, symbiotics can be used as a therapeutic intervention for the treatment of various neurological disorders. They behave in the similar fashion. Most of them usually regulate the activity of BDNF. Most of them actually regulate the microbiota which is available in a gut. Most of them actually regulate the different neurotransmitter system. Out of this, the important one is serotonin, dopamine and norepinephrine. And ultimately, they all together work in the similar fashion so that maximum benefit can be drawn out of it for the benefit of a CNS disorder. Dietary modification, I will not take much time, but this is again one of the most important parameter where the budding pharmacist or research scholar can work for the development of a therapeutic intervention for the prevention and the treatment of a neurological disorders. Ketogenic diet is one of the most fascinating alternative therapy for the prevention and treatment of a neuropsychiatric complication. Chronotherapy, coming to the most important element or component of a sleep cycle, is a melatonin. It is the hormone which is releases from the brain during the course of sleep cycle, and it is providing several health benefits starting from a neuroinflammatory pathway inhibition to the mood regulation. Melatonin can be targeted for the therapeutic intervention in a drug discovery processes targeting CNS disorder. These are the pathways which are activated by a sleep deprivation and how we can prevent it. One of the most important molecule which is activated is adenosine. It is considered a villain in this therapy, and then hero acting as a neuroprotective agent considered as a melatonin. Microbiome based therapy, coming directly to different segments which can be targeted as a restoration, as a maintenance of a microbiome. And nowadays many industries, many scientific laboratories are working how we can restore the gut microbiota. And the most fascinating aspect of this or the conventional therapy can be challenges by this fecal microbiota transplantation. So many negative aspects of microbiome are there which can be dysregulated by lifestyle modification, can be regulated if we get involved in a regular exercise, if we modify a lifestyle in a such a way that it will be adding benefit to our life without creating more complications. So prebiotic, probiotic, symbiotic, fecal microbiota transplantation and diet can actually provide various therapeutic benefits in the CNS disorders. This is again one of the interesting area which is actually associated with the mood regulation and can be targeted for a drug discovery in the CNS disorders. So altogether, the final message is that when we involve in physical activity accompanied by a normal Mediterranean ketogenic diet, cognitive training and mindfulness, it is not only associated with reduction in a metabolic complication, but in a long run, it is going to provide a mood regulation and neuroprotection to your brain circuitry. So these are the experimental protocols which we carry out at our laboratory and can be done at any other laboratories of the India. They are very easy experiments and can be associated with a new therapeutic intervention for a CNS disorders, right? So we can train the animal on the treadmill. This treadmill exercise has been evidently proven to have the therapeutic benefit to various neuropsychiatric complications. We can develop a model which can be associated with a sleep deprivation. So here you can see a sleep deprivation chamber which is continuously in the shaking state. It can be associated with the disturbances in the sleeping behavior. Ultimately, you can have a sedentary lifestyle of the rodents where you can bound them in a particular environment, not having much more chances for a physical activity. And this can altogether can be targeted for the therapeutic intervention in a CNS disorder. So these are the neurotransmitter which can be again targeted, whether they can getting influenced by the physical exercise or lifestyle modification or not. We can challenge the social issues, we can challenge our own complications, own problem, whether they are getting benefited by the physical exercise or lifestyle modification or not. The most important issue is alcoholism. Okay. So thank you very much, all of you. At this platform, I just want to thank the organizer of the institute, the management of the institute, principal, my student, Dr. Tawkir, all his teammates. It is all about the teamwork. They have given their 100%. It has well resulted into a great conference within a 2 days time span, and this platform I must utilize for the heartful thanks to my management, my principal, our next principal, Dr. Atul Hemke sir, for all the benefits, all the freedom, all the scientific environment they have created at SKB College of Pharmacy, Kamti, so that whatever the little distance we have traveled and contributed significantly to the neuroscience. Thank you very much, all of you. Is there any question? I'm ready to answer it.
Session is open for all. If anyone have any query, any question, they can ask. Okay, sir.
Hello. So thank you very much, sir. Again, it was pleasure and privilege to be chair a session of Mind Teacher, and this is in fact from last 2 months I am again fortunate to have this sort of opportunity in various conferences. Sir has delivered session on decoding the science of lifestyle modification for therapeutic innovation in CNS disorders, where sir has highlighted each and every aspect related with the physical activity, which are very much essential for our lifestyle, which will ultimately going to inhibit certain CNS disorder by molecular modification, as well as the main hero sir has highlighted already, that is BDNF, which is brain-derived neurotrophic factor, which is an important key factor, a growth factor for all CNS development. And his research, and sir has already highlighted the key diet factor, lifestyle modification in sense of sleep cycle, as well as our diet factor, as well as physical activity, which are going to be the key factor for ultimately decreasing all these neurological disorders, particularly Alzheimer's, dementia, Parkinson's, etc. So thank you very much, sir. Thank you very much, Dr. Tawkir and team KC Bajaj, for inviting us to this 2 days national conference. As already Taksande sir has appreciated, for as this is the second year of the institute, still they are organizing such type of national conference. Thank you very much, management of KC Bajaj College of Pharmacy. And once again, thank you very much, Dr. Taksande sir, for highlighting all these key aspects. Definitely, students are going to be benefit with all your key concern research. Thank you, sir.
Thank you so much, Nitin Dumore sir, for your words of wisdom. And again, thank you so much, Dr. Brijesh Taksande sir, for giving us profound knowledge of autism. We are grateful for the valuable insights you provided today. We gained a lot from your session. That was truly enlightening session. Thank you so much, sir. There is one instruction for the students, those are participated in the poster presentations. Kindly submit your posters to the poster presentation hall to the back of the auditorium. Now it's my honor to invite respected Principal Dr. Mohammad Taqir Sheikh sir to present a token of appreciation as a symbol of love and gratitude from KC Bajaj College of Pharmacy and Research to Dr. Brijesh Taksande sir, Professor Dean Research Accreditation at Srimati Kishoritai Bhoyer College of Pharmacy, Kamti. Then again, it's my honor to invite respected Principal Dr. Mohammad Taqir Sheikh sir to present token of appreciation from KC Bajaj College of Pharmacy and Research to Dr. Nitin Dumore sir, Associate Professor Radha Sahib Balpande College of Pharmacy, Nagpur, Head of Pharmacology Department. Again, I would like to invite our respected Principal Dr. Mohammad Taqir Sheikh sir to present token of appreciation from KC Bajaj College of Pharmacy and Research to Dr. Geeta Lodhi ma'am, Principal Taiwade College of Pharmacy, Nagpur. Thank you, sir. Now I'd like to hand over the podium to Mr. Akshay Bidwaik, sir. Please, sir.
So, now we are moving toward our next session. Good afternoon everyone, this is Akshay Bidwaik, Assistant Professor at KC Bajaj College of Pharmacy, Jaripatka, Nagpur. And it's my great honor to welcome you all on behalf of our today's national conference on the theme, Natural to Synthetic, the Convergence of Traditional Medicine to Modern Medicine. I would like request to our Principal Sir, Dr. Mohammad Taqir Sheikh sir, and our resource person Dr. Shagufta Khan ma'am, along with our chairperson for this session Dr. Atul Hemke sir and Dr. Syed Sajad sir. To kindly occupy the dais. Now, I would like to invite Dr. Mohammad Taqir Sheikh sir to please felicitate Dr. Shagufta Khan ma'am with floral bouquet, shawl and shrifal. Thank you, ma'am. Also, I would like to invite our principal, Dr. Mohammad Taqir Sheikh sir, to please felicitate Dr. Atul Hemke sir, Principal Srimati Kishoritai Bhoyer, College of Pharmacy, Gada, Nagpur. Also, I would like to invite our principal, Dr. Mohammad Tawqir Sheikh sir, to please felicitate Dr. Syed Sajjad sir, Principal, Central India College of Pharmacy. Thank you, sir. It's not every day we get the chance to learn from someone with such distinguished career, and we are thrilled to have them with us today. Let's commence our next session by acknowledging the remarkable contribution of Dr. Shagufta Khan ma'am. It's our privilege to introduce Dr. Shagufta Khan ma'am, Professor of Pharmaceutics at Institute of Pharmaceutical Education and Research, Varda. With over 24 years of teaching experience and 18 years of dedicated research, Dr. Khan ma'am has established herself as leading academician and researcher in field of pharmaceutical science. She holds an M.Pharm from Jamia Hamdard, New Delhi, and PhD from Rashtrasanta Tukoji Maharaj Nagpur University, Nagpur. Dr. Khan ma'am research expertise include novel drug delivery system with special focus on nanocarriers, nasal drug delivery for brain targeting, and controlled drug release formulation. She has successfully guided 74 M.Pharm students and 2 PhD scholars and has received prestigious research grants from All India Council for Technical Education. A profile author, Dr. Khan ma'am has over 50 research publications, several patents, and book chapters to her credit. She also serves as a reviewer of reputed journals, actively contributes to academic and research bodies at university and national levels. Her innovative work and impactful contribution have earned her recognition to both national and international platforms, including award for best presentation and invited talk at prestigious conference. We are delighted to welcome Dr. Shagufta Khan ma'am to deliver her insight during this plenary session, and we look forward to her enriching contribution to conference. Ma'am, we humbly invite you to enlighten us with our knowledge and insight on nano-engineered phytoactive delivery target nano-carrier system for precision cancer therapy. Please, ma'am.
मैम पोडियम भी है और कॉर्डलेस ऊपर कर
A very warm good afternoon to all of you, and it's indeed a pleasure to be here today. At the outset, I would like to thank Principal of this institute, Dr. Tawqir Sheikh, for giving me an opportunity to express my views on nanotechnology for phytochemical delivery. It's indeed a pleasure to be here today to focus on an important topic that holds an immense holding on the future cancer therapy. And despite a lot of advancement in the cancer therapy, cancer still is the major health issue, most formidable health challenge that needs to be taken care of, and there is a pressing need for the development of new formulations, for the development of new technology. And this is where the nature meets with the nanotechnology. For centuries, herbs have demonstrated their capability to work against the cancer, but there are numerous shortcomings associated with the phytoactives, that is their poor solubility, bioavailability, rapid metabolism and clearance, and their poor capability to reach the target site. And therefore, there is an immense need to make them meaningful formulations, and for that, nanotechnology is being explored widely while the targeted therapy, it targets the specific gene or the protein responsible for regulating the cancer. So therefore, it is quite specific. It acts on the cancerous cells and spare the non-cancerous cell to the large extent. Although the absolute targeting specificity has not yet been achieved, but as compared to the conventional therapy, here the side effects is significantly low. The conventional therapy includes chemotherapy as well as the radiotherapy, and chemotherapy normally it is done in cycles and administered as the intravenous administration only, but targeted therapy can be given by intravenous route as well as the oral route. But because there is the involvement of the complex technology in development of these drugs, so therefore targeted therapy is costly as compared to the conventional therapy. And the most important difference is the development of resistance in case of conventional therapy, which is less in case of targeted therapy, because the cancer stem cells, they are the pluripotent cells, they have the stemness, and they remain in the G0 phase, that is the stagnant phase, and therefore the chemotherapeutic agents and radiotherapy miss them. And when there is stimulation, they again move to the dividing phase. So therefore, the conventional chemotherapy failed to detect cancer stem cells and failed to kill cancer stem cells, and they are mainly responsible for the cancer resistance and metastasis. At the same time, the conventional therapy, they reach to the target site in the low amount, and they are also the substrate to the P-glycoprotein, which is overexpressed in cancer cells. So they are effluxed out of the cell, and these are the other reasons for the development of the resistance. And the resistance development is very low, but effectiveness is possible if the cancer expresses the target in large amount. If the targets are not expressed in the desired quantity, targeted therapy will not work. So this was about the side-by-side differences between the conventional and the targeted therapy. Now, after understanding this, that targeted therapy is highly desirable for treating this dreadful disease, we will move on to the complementary medicines, that is herbs, and their role in the cancer treatment. So, although there is advancement in the targeted drug delivery system, lot of research is going on, and there are fruitful outcomes as well. But the role of phytoactives, the role of herbs, has not been completely explored. There still exists the gap in the advancement of the herbs in the treatment of cancer-like diseases. So for centuries, herbs have demonstrated effect against the cancers. They are the very good source of the phytoactives that have in the recent decades proven to be very effective against different types of the cancers. And they are rich source of bioactives like flavonoids, alkaloids, terpenoids, and polyphenols, and these phytoactives have shown potential against the different cancer cells. But if you look at the pattern of the research, you will find that mostly the herbal extracts are being utilized for the investigation. But herbal extract consists of multiple components. Herbal extract consists of multiple components, and it is very difficult to ensure, it is very difficult to find out that which phytoactive is responsible for the anti-cancer effect. And in addition to that, the composition of the herbal extracts varies with respect to the source, varies with respect to the extraction method. So therefore, the chances of clinical success is very low. And the aim is to have the clinical translation of the preclinical studies. Then only herbs can be proven successful. So as compared to herbal extracts, phytoactives have greater chances of clinical success because they are the separate entity, and fixed dosing is possible. The administration in fixed dose is possible, and also the mechanism of the anti-cancer effect can be detected when a single moiety is administered. So as compared to the herbal extracts, phytoactives have more potential. They are more promising, and there is greater opportunity of clinical success. But the major drawbacks of phytoactives is, although they have demonstrated very good anti-cancer effect in different cancer cells during in vitro testing, but they have failed in the clinical trials because of the severe or grave pharmaceutical issues. For example, they have poor water solubility, they have poor bioavailability, they are prone to extensive metabolism, and they clear out rapidly. In addition to that, they are susceptible to conjugation reactions like the sulfate formation, glucuronide formation very rapidly, that make them ineffective. Their half-life is very short, and they are not successful as a simple formulation. So therefore, if the integration is done, integrating phytoactives with the nanotechnology presents a very important opportunity. It prevents a potential opportunity to take phytoactives to the next level so that they become clinically meaningful, and the therapeutic outcome can also be improved. The nano carriers can enclose the phytoactives. They improve because of their small size. They can improve the solubility of nanoparticles, solubility of phytoactives or phytochemicals. They can improve the stability, and moreover, they can provide the targeted delivery of phytoactives to the cancer cells. So after looking at the advancement in the herbal medicine, let us look at the close differences between the phytoactives and the nanocarriers loaded with the phytoactives. मुझे चेंज करने में ये क्यों नहीं हो रहा इधर we'll look at the differences in the free phytoactives and the nano carrier loaded phytoactives to understand the importance of combining or integrating phytoactives with the nano carriers to improve the therapeutic outcome. So you can see that free phytoactives have poor pharmacokinetic properties and as well as physicochemical properties. Their solubility is poor, their stability is poor, they are prone to degradation under the different pH conditions. Many phytoactives are not stable in the gastrointestinal tract. Even after reaching the systemic circulation, they are not stable. Then they are prone to rapid metabolism. As I told you that they form the conjugation, they undergo conjugation reactions. So therefore their metabolism and clear is very rapid. Then to overcome this, normally they are administered in high doses that results into the potential toxicity. Their membrane permeability is poor, so therefore they cannot be utilized for targeting brain because the blood-brain barrier is a very tough barrier for most of the moieties. And they are prone to the efflux by P-glycoprotein. As I told you before, that multi-drug resistance is mainly because of the P-glycoprotein which is overexpressed in cancers. So they are prone to be effluxed by the P-glycoproteins. And because of all these problems with the phytoactives, their clinical success is limited. While after loading phytoactives in nano carriers, you know that nano carriers are very small in size, and particularly for targeting the size should be less than 200 nanometer. So because of the size reduction to the nanometer level, there is improvement in the surface area, there is improvement in the solubility. Also, the nano carriers prevent aggregation of the drugs, so therefore aggregation of the phytoactives. So in that way also it improves the solubility, prevents the phytoactives from the outer environment, exposure to the outer environment, and therefore improves stability. And you will also understand that the nano carriers, they prevent the interaction of the phytoactives with the efflux protein, that is P-glycoprotein. And therefore nano carriers prevent the efflux of the phytoactives and reduces the multi-drug resistance. So these are the important properties imparted by the nano carriers, that is nano carriers improves both pharmacokinetics and the physicochemical properties, stability, and also provide the targeted therapy. So in the further discussions we will be focusing on the case studies involving phytoactives, how the nano carriers have resulted into the increased anti-cancer activity and increased bioavailability. Now, before diving into the details of how nano carrier loaded phytoactives can act against the cancer cell, it is very important to at first understand the cancer biology and the microenvironment, because scientists have utilized the distinct microenvironment of the cancer cells in developing the new drug delivery systems. So the microenvironment of the cancer cell is different from the normal cell. You must know that you can see here the normal tissue consists of the normal blood vessels with the cells of the blood vessels adhered to each other, presence of tight junction, so nothing can extravasate through the vessels, and you will find pericytes and fibroblasts, and you will also find lymph vessel present in the normal cell. Okay? So the structure of the vessel and the presence of the lymph node or lymph vessel in the normal tumor cells is very important. In the microenvironment of the cancer cells is very important. Now I would like to tell you that when the tumor size is about 1 to 2 millimeter cube, when the volume is 1 to 2 millimeter cube, it is non-angiogenic. Angiogenesis means the development of the new blood vessels. So it is non-angiogenic and takes the nutrients from the adjacent cells. Okay, when the volume is up to 2 mm cube, it takes nutrition from the adjacent cell. It is non-angiogenic. But when volume increases past 2 mm cube, its demand increases. And now the diffusion from the adjacent cell of the nutrient and the oxygen fell short of the demand. So angiogenesis starts at this point. Okay? There is the upregulation of hypoxia-inducing factor. There is upregulation of hypoxia-inducing factor because when the size increases, the cell starts becoming hypoxic. The cell starts becoming hypoxic, and there is the upregulation or overexpression of hypoxia-inducing factor 1. And from this point only, from this stage only, the angiogenesis starts. This is the inducer for the angiogenesis, and the cancer cells start making their own blood vessels. The HIF, that is hypoxia-inducing factor, activates and results into overexpression of several pro-angiogenic proteins. Okay, these proteins are responsible for the blood vessel formation. And the pro-angiogenic proteins include vascular endothelial growth factor, that is VEGF, plasma-derived growth factor, that is PDGF, then tumor necrosis factor. These are the pro-angiogenic proteins that starts the angiogenesis. And with the upregulation of these proteins, there is activation of the endothelial cells. Okay, there is activation of the endothelial cells. Endothelial cells increases the production of alpha V beta 3 integrin protein. This is the protein that associates with the extracellular matrix. Okay, they interacts with, this is the extracellular matrix you can see here. So the alpha V beta 3 starts interacting with the extracellular matrix. And with this activation also, the metalloproteinase proteins, enzymes, are also upregulated. They are responsible for the disruption of the extracellular matrix. And this is the stage where the migratory process starts. Migratory process means the cells from the extracellular matrix migrates to the tumor side where angiogenesis will start. So breakdown of the extracellular matrix takes place and cells starts migrating towards the site of the cancer. And during this stage, the inner epithelial cell, they undergo apoptosis to form the vessel-like structure. And a lot of remodeling takes place at this stage, but you must understand that the remodeling is defective here in this case. Okay, the remodeling is defective here in this case, and because of this, the membrane is with the pores. The membrane is with the pores. There are numerous penetrations. You can see they are not regular, rather they are tortuous. Okay, you can see on this side the B defective blood levels with many sac-like formations and penetrations, because the last stage, that is remodeling, is faulty. Remodeling is faulty. And the pore size varies from 100 to 1000 nanometer depending upon the types of the cancers. Okay, and this is the penetrations. This is the pore which is being utilized for delivery of nano carrier. Okay, why I have explained this? Because you must understand the pore size of the new vessels which are produced by the tumor cells. It ranges from 10 to 1000 nanometer, and mostly in most of the cases up to 200 nanometer, and therefore the nano carriers, nanoparticles with size less than 200 nanometers can very easily extravasate and come to the extracellular space near the tumor cells. Now, in addition to that, there is also difference in the microenvironment pH, which is also utilized for drug targeting. In case of the normal cells, and I will also like to tell you that the lymph vessel is absent. The lymph vessel is completely absent in the cancerous microenvironment. Now, in addition to the faulty blood vessels, another important aspect which is being utilized or which has been successfully utilized for targeting the nano carriers to the tumor tissue is the microenvironment pH. The microenvironment pH in normal cell is neutral to slightly alkaline, both intracellular and extracellular. However, in case of the cancer cells, the extracellular pH is slightly acidic. It is slightly acidic. Now what happens, as I explained you that the cancerous cells are hypoxic. So therefore, for energy, breakdown of glucose takes place in anaerobic condition. In normal aerobic condition, glucose converts into pyruvate, okay, by glycolysis, and this pyruvate is utilized by mitochondria, which releases carbon dioxide and ATP as the energy. But as the cancerous cells are hypoxic, therefore they convert pyruvate into the lactic acid. Anaerobic glycolysis takes place in cytosol, and they convert pyruvate into lactic acid. That results into the decrease in pH within the cell, that is intracellular pH. But you must understand that if the intracellular pH decreases, that will cause apoptosis or cell death. So to prevent apoptosis, cancer cell starts activating all the proton exporters. And the proton from inside the cell is expelled outside. The proton expulsion pumps like Na plus, H plus, Na plus, K plus, ATPase, they are all activated. So cancer cell pushes the protons outside, and that results into the slightly acidic pH in the extracellular space. So is it clear how there is a difference in the microenvironment pH? It is slightly acidic because of the pushing of protons from the intracellular space into the extracellular space. And also because of the poor heat exchange, the microenvironment, that is the environment surrounding the cancer cells, are little hypothermic. The temperature is about 40 degrees Celsius. So if during the formulation of nanocarriers, if the polymers or phospholipids or proteins are selected which destabilizes in the acidic condition, so they'll destabilize in the extracellular space only, resulting into the drug release at the site. Similarly, there are also phospholipids that show the degradation at higher temperature. So under the hypothermic condition, they will destabilize, uncoil, resulting into the drug delivery at the site of the cancer only. Now, after understanding the microenvironment, we will move on to the targeting strategies which are widely utilized for targeting the cancer cells. And all these facts are utilized for targeting the nanocarriers to the cancer cells, that is the faulty blood vessels, the acidic extracellular space, and the hyperthermia. The major targeting strategy includes the passive targeting. The success with passive targeting is low, so that has been improved by active targeting. And by combining all three, that is passive, active, and physical targeting, great success have been achieved in increasing the drug concentration at the tumor target site. Now, this passive targeting is based on the EPR effect, which is called as enhanced permeation and retention effect. As I told you that as compared to the normal blood vessels, at the site of the tumor, there are penetrations. Okay, there are penetrations or pores. So nanoparticles can extravasate, can come out through the vessel and reach into the extracellular space. You can see here this figure, permeation of the liposomes through the penetration because of the faulty vessels in the extracellular space. Okay. Now, for the successful extravasation at the site of the action, it is important that the nanocarrier remains in the circulation for long. And for that, pegylation is done, that is linking with the polyethylene glycol chains. As soon as the particles go into the systemic circulation, they are taken up by the reticuloendothelial system. They are very rapidly eliminated from the blood vessels, from the circulation by reticuloendothelial system. So, to dodge the reticuloendothelial system so that the reticuloendothelial system fails to recognize the nanocarriers, it is important to add polyethylene glycol chains. So pegylated liposomes are nothing but the polyethylene glycol chains grafted to the liposomes. So reticuloendothelial system fails to recognize them and they move through the penetrations, they remain till they reach the target site, and there, because of the vessels, they come out, the pores in the vessels, they come out at the target site. Now, why EPR? Enhanced permeation because of the penetrations because of the pores. But how they are retained at the site? That is because I told you in the previous slide that cancer cells in the microenvironment, there is complete absence of the lymph vessels. Lymph vessels are responsible for the drainage of any foreign substance. So it is completely absent. So once the particles enter into the microenvironment, it will remain there because there is absence of the lymph vessels. Okay. This is again the specialty of the tumor microenvironment that has been utilized for passive targeting. Now for success of the passive targeting, size is very important. And it is shown that nano carrier with size 100 nanometer are good for retention at the site. Now why the size control is important? Okay, because there is interstitial fluid pressure which is high at the core of the cancer. The interstitial fluid pressure is high at the core of the center, which is 20 mmHg, while at the periphery the pressure is 0 mmHg. So because of this pressure difference, small particles will drain out, although they are entering through the penetrations into the extracellular space and the target tissue, but they will also drain out. So less than 50 nanometer size have not shown retention in the cancer cells. So therefore it is optimized that 100 nanoparticles can move very easily through the penetrations and they can resist the interstitial fluid pressure to remain at the cancer site. So three aspects are very important for passive targeting. Number one, particle size should be less than 200 nanometer to extravasate through most of the cancers. And in that specifically, it should be near to 100 nanometer. It should not be very small, that is less than 50 nanometer. Otherwise, it will drain out back. And number two, the long retention, long circulation, so that it remains in the circulation till it reaches the site of the action. Otherwise, particles are rapidly removed from the body by the reticuloendothelial system, and for that reason pagylation, that is attachment of polyethylene glycol chains, is very important. The second is the active targeting. You can see there in the figure, the nano carriers are decorated. Their surface is modified with the ligands that can recognize the receptors which are overexpressed. Because of the high demand, as I told you that when the size increases, the demand increases, there is enormous level of the multiplication of the cells, and for that number of the markers are overexpressed which are involved in angiogenesis and cell multiplication and growth. So if the ligands are attached to the nanocarrier, then they can specifically bind to the markers or receptors on the cell and internalized there by receptor mediated endocytosis to release the cell within the drug within the cell. Okay, so this is more efficient than the passive targeting. Here as well, the size optimization is important, long circulation is important, and in addition to that, here the nanocarriers are decorated with the ligand which can bind specifically to the markers which are overexpressed on the cancer cell and internalize to release the drug into the cell. The third is the physical targeting that utilizes the fact that the pH is less in the microenvironment. So here the nanocarriers are made up of or liposomes and nanocarriers are made up of the phospholipids or the polymeric or the polymers which degrades in the acidic condition. So here as well, size is important, long circulation is important. When the nanocarriers extravasate and comes in the extracellular fluid, extracellular space, because of the low pH, the phospholipid degrades, resulting into the drug release. So these are the three major strategies for drug targeting. So now we'll move on to specifically on to the phytoactives. We'll take some examples of the phytoactives which have shown enormous effect, which have shown excellent effect against the cancer cells, but they have failed because of the problems that I have discussed and the poor delivery to the target cells. These are some of the most researched phytoactives. If you go through the research articles, you'll find numerous literature on the investigation about these phytoactives. The first one is curcumin. It is present in Curcuma longa, and it has shown apoptosis, that is cell death. It has also shown to interact with the cancer development pathways. It suppresses angiogenesis, that is vessel formation. But still, there is no formulation of the curcumin for the therapeutic effect. It is used as the supplements with the other anti-cancer drugs, but it is not available on the market as the therapeutic agent for treating cancer. The challenges include extremely poor bioavailability because its solubility is very poor. It tends to aggregate and it is prone to destabilization. It is prone to oxidation and hydrolysis. Therefore, it does not remain stable in the biological milieu. And it undergoes very rapid systemic elimination because of the phase 2 biotransformation, and its absorption is also very low from the gastrointestinal tract. The next one is resveratrol. Resveratrol has shown wonders in the in vitro testings and the preclinical studies. It is reported that it acts against multiple pathways that leads to the multiplication and the overgrowth of the cells. So scientists are very keen to investigate on resveratrol, and in the subsequent discussion you will see that plethora of research have been taken place involving resveratrol to somehow take it to the clinics. So it is very effective. It induces apoptosis, inhibits metastasis, but it is very rapidly cleared from the body. It is prone to metabolism. It has poor aqueous solubility, limited absorption, and low systemic bioavailability. In addition to that, resveratrol is not stable in alkaline and neutral pH as well. So even if it moves into the systemic circulation, it does not remain stable in the systemic circulation. So it is highly desirable. There is a pressing need that resveratrol should be taken to the cancer cell and released at the site only, so that it is prevented from metabolism and destabilization even in the systemic circulation. The next one is quercetin. It is widely available in onions, apples, and berries. It is a flavonoid. It inhibits tumor growth. It also inhibits angiogenesis and metastasis, that is a spread of the cancer stem cells to different organs. But it is also affected by the poor solubility, poor absorption, and also it is prone to the rapid degradation. Its half-life is very short in the blood. So therefore, this drug also needs to be included in a delivery system that can effectively take quercetin to the target site. Then epigallocatechin gallate, this has also proven effectiveness. It is present in the green tea. It is present in the green tea, and it is said that administering green tea can prevent the cancer. It has antioxidant effects as well. But taking 2 cups of green teas in a day results into only 0.1% availability of epigallocatechin gallate. And the concentration in the blood is very minute, that is only 15 micromole. This is far, far less than the required therapeutic effect. So taking green tea will not impact in any way against the cancer unless and until this phytoactive is removed and from the green tea or other sources and delivered through the high throughput nanotechnology to take it to the target site. So it is highly unstable. You can see at the physiological pH also. Within 15 minutes, it is eliminated from the systemic circulation. So you can imagine just 0.1% bioavailability, 15 micromole concentration, and that too eliminating within 15 minutes. So what would it do against the cancer? The next is the berberine. It is found in Berberis species. It consists of alkaloid. Like the other phytoactives, it has also shown effect against the cancer cells during the in vitro studies, but it is also prone to lower bioavailability, solubility problem, and also it has limited permeability. It cannot cross the biological membranes, and therefore it is administered in high doses, which is toxic as well. And the last one, which is widely being researched in China, that is honokiol, which is extracted from magnolia bark. It has also proven success in the in vitro studies, that is anti-tumor, anti-inflammatory, and antiogenic effects, anti-angiogenic effects, but it is also very hydrophobic in nature, and its solubility and bioavailability is very poor. So after understanding the fact that in actuality phytoactives owe a great potential because of their effect against the cancerous cells, but they are only failing because of their poor physicochemical properties and the non-capability to reach to the target site. So several investigations are being done during this decade to improve the physicochemical properties and to take the phytoactives to the target cells. So we'll see some of the case studies and their finding, and also we will see what are the phytoactives which made it successfully during the clinical trials and are on the market, and which are still through the pipeline. For delivery of phytoactives, the most widely investigated nanocarriers are the lipid-based nanocarriers. Lipid-based nanocarriers include what? Lipid-based nanocarriers includes liposomes, includes solid lipid nanoparticles, nano-structured lipid carriers, okay, and also the micelles, they are the part of the lipid based nanocarriers. They are widely researched because of some special benefits they owe with them. That is, they can entrap both hydrophilic and lipophilic drugs. Because most of the phytoactives are lipophilic, so they can be entrapped successfully in liposomes. Liposomes improve the solubility of such drugs, and liposomes can penetrate very well through the lipoidal membrane, because the cell membrane is also lipoidal in nature, so they can interact with the lipid membrane and take the drug inside. So liposomal curcumin, it is a patented formula, Meriva. It is for the oral consumption, and it is used as the complementary support. It is used as a supportive therapy for the with the conventional therapy. And here the curcumin is loaded in the liposome, and you must understand that liposomes, I think all of you know that liposomes are made up of phospholipid bilayer. Okay, they are made up of phospholipid bilayer as the vesicles with the entrapment of aqueous phase between the phospholipid bilayer. And you must note that there are certain phospholipids which are fusogenic. Fusogenic means they can fuse with the cell membrane. For example, phosphatidyl ethanol amine, PE. It is a fusogenic liposome. It can fuse with the cell membrane and directly enter into the cell membrane and take the phytoactive or the drug loaded with it into the cell membrane as well. You can see in the figure the first mechanism here. This is showing the fusogenic liposome. It is fusing with the cell membrane and directly entering into the cell, releasing the content inside the cell. So there is one mechanism, and like phosphatidyl ethanol amine, there are other fusogenic phospholipids as well, which can be utilized to have direct penetration into the cell. And second is the cell-mediated endocytosis. I would like to tell you that why nanocarriers improves the bioavailability so much, because nanocarriers can be entrapped by the cell by the endocytotic process. They are small particles, and you all have learned in endocytosis that small particles are entrapped by phagocytosis, the macromolecules and small particles. So these are very small particles with around 200 nanometers or less than that. So they can also enter into the cell by the endocytic process. And it is shown that curcumin loaded in liposome is absorbed by the enterocytes, the cells of the intestine, by endocytosis, resulting into high blood concentration. So this is a patented formula of liposomal curcumin, that is Meriva, and it was tested in the clinical trial, phase 2 clinical trials involving 44 advanced pancreatic cancer patients, and it was administered at the dose of 200 mg per day and it was given as a supplement with gemcitabine as the infusion for 28-day cycle, and advantage was observed in the anti-cancer effect of gemcitabine. And it is reported that it is like the combination of paclitaxel and gemcitabine with the advantage of producing low toxicity. So curcumin is able to increase the effect of gemcitabine with the reduced toxicity. So this improvement is because of what? This improvement is because of the multi-target activity. Gemcitabine will act on one target, curcumin will act at different targets, and because of the multi-target activity, the drug resistance is reduced and efficacy is increased. Now let us move on to the next example. This is another example which is a patented technology, but I would like to clear that all these are as the supplements. Okay, all these are the supplements, not as the therapeutic agent. Still, there is a gap in achieving that. So this is Plexome, liposomal formulation again of curcumin, and it consists of phosphatidylcholine as the lipid, phospholipid, and it is developed by Technologies Private Limited, Australia, and it was tested in vitro cell culture as well as the in vivo mice model against the adenocarcinoma lung cancer cell line, and it is established that it acts at the pathways responsible for cell multiplication. It reduces estrogen receptor alpha. It reduces estrogen receptor alpha, and also it reduces the epidermal cell association molecules, prevent the association of the cancer cells that result into the apoptosis of the cancer cells. You can see here the reduction in the bioavailability is significant with Plexome, that is liposomal curcumin formulation. Moving on to the next important and very interesting moiety, that is resveratrol. There are several liposomal formulations of resveratrol to improve its anti-cancer activity, but I have taken up here to discuss the most recent ones with the greater efficacy. So this one is the multifunctional targeting liposomes. That means consist of more than one type of ligands. Okay, the phospholipid or liposomes are very amenable to the surface modification as well. It is easy to attach the ligands to the phospholipid, and therefore they are the potential carrier for active targeting. So here the two ligands are wheat germ agglutinin, which is a lectin and found to be very successful, and the second one is mannose. Mannose binds with the glucose transporter. You must know that glucose transporters are overexpressed over the cancer cells against the normal cells, and lectin also binds with the sugar on the surface. So multi-target is achieved by attaching two ligands, that is wheat germ agglutinin and mannose, and it has been investigated for brain cancer, that is very aggressive cancer, glioma, and it is observed that after IV administration, and I'll also like to explain here that the liposomes are the pegylated liposomes. You can see there DSPE, that is disteroyl phosphatidyl ethanol amine. Okay, it is disteroyl phosphatidyl ethanol amine. It is conjugated with polyethylene glycol, and then it is the amine salt for linking the ligands to it. So it is a pegylated liposome with the ligand, it can remain in the circulation for long and also target the receptors on the cells. So you can see here in this figure that because of the size control, they are capable of passing through the blood-brain barrier. They are binding with the glucose transporter overexpressed in the cancer cells, resulting into the apoptosis. Then this is the polymeric nanoparticles consisting of the biodegradable polymers, a little bit different from the liposomes. The polymeric nanoparticles are capable of extending the rate of the drug release. Okay? Not only it can prevent the drug degradation in the biological milieu, it can improve the solubility, bioavailability, and also the polymeric nanoparticles can provide the controlled drug release for long period of time. So here the resveratrol was encapsulated in polyglycol lactic acid polyethylene glycol particles, and it was conjugated with chitosan, and it was used against the orthotopic mouse model where the colon cancer was grown, and it was found that you can see here the blue color is showing low vascularity and red color is showing highest vascularity. So you can see that angiogenesis is successfully reduced in nanoparticles consisting of resveratrol. You will find the blue dots here. The next one, this is very interesting formulation of resveratrol that is called as biomimetic polymeric nanoparticles. Okay, why biomimetic? Because what is the major problem, what is the major challenge when a nanocarrier enter into the systemic circulation? It is taken up by the reticuloendothelial system. And for that purpose, only polyethylene glycol is attached. But prolonged continuous administration of high dose of polyethylene glycol has shown the adverse effect as well. So in biomimetic nanoparticles, the nanoparticles are encapsulated into the red blood cell membrane. So this is what is done. Here the nanoparticle is coated with the erythrocyte membrane, and it is coordinated with the cell penetrating peptide. RGD is cell penetrating peptide. So you can see here that because of the erythrocyte membrane, it bypasses the reticuloendothelium in system efficiently, moves to the cell surface, and with the cell penetrating peptides enter into the cancer cell. Okay, there is the pathway, important pathway that the resveratrol is found to affect within the cell, but because of the shortage of time, I will not go into the depth. Otherwise, I have explained here the very important finding of resveratrol after entering into the cell. Then the smart nanocarriers, lastly, which behave according to the pH and temperature of the microenvironment. As I told you that the pH is acidic and the microenvironment temperature is also high. So nanocarriers act according to the pH and releases the drug there. So this is one example where quercetin is loaded on a pH responsive nanoparticles. Here it is phenyl boronic acid conjugated zinc oxide nanoparticles. So boronic acid is the ligand because sialic acid is highly expressed on the cancer cells. Boronic acid binds with sialic acid and enter into the cancer cells. And because of the acidic condition, zinc oxide rapidly dissociates into Zn2 plus in the acidic condition, and here both that causes the mitochondrial dysfunction. Mitochondria is constricted because of that, leads to lipid peroxidation and DNA damage. And also the quercetin is working, so there is multi-targeting by Zn2 plus and quercetin, and that too initiated by the fact that the microenvironment is acidic in condition. Similarly, the last one in this is the reduction sensitive nanocarriers. In case of the cancer cells, there is increase in the glutathione level, that is GSH, which makes the reducing environment inside the cells. You can see the diagram here. Phytoactive is loaded, and to make use of this fact, normally the disulfide bonds are attached in the nanocarriers. So when enters into the cell, because of the high glutathione level within the cell, SS bond converts into SH bond, that is reduction of the disulfide bond, resulting into the destabilization of nanocarrier within the cell and degradation, resulting into the drug release. And the next one is the combination therapy, where the conventional drug is administered with the phytoactive loaded nanocarriers, so they act on the multi-target. There is synergistic effect, so there is reduced adaptive treatment tolerance, there is reduced resistance to the drug therapy, and also reduced side effect. We'll look at very rapidly some of the phytoactive nanoparticles which are on market. Only two are there, that is paclitaxel nanoparticles, intended for the metastatic breast cancer. And the second one is docetaxel. It is a semi-synthetic analog of paclitaxel. It is for breast and the non-small lung cancer and prostate cancer. And if you look at the advancement, you'll find that quercetin, PEG, PLGA nanoparticles has reached to the phase 2 clinical trials for tongue squamous carcinoma, and initial study revealed that there is decreased in viability and increased apoptosis. So it is a great success with respect to the advancement of the phytoactive after bridging the gap between the traditional medicine with the most advanced nanotechnology. Because of the nanotechnology involvement, nano-engineered particles, quercetin has taken to the phase 2 clinical trials successfully. So now we'll see what are the challenges and what is the way forward. Why most of the phytoactives, despite showing great success in the preclinical phase, do not move to the clinical trials. The three main important reasons are, the key issues are, number one, variability in the phytoactives. There is a greater need of standardization. The quality of phytoactives changes from the source and the extraction process. And the second key issue is that there is no clear regulatory guidelines for undertaking the clinical trials. The FDA and EMA desires a strong safety, efficacy, and quality support, and phytoactives have not met that requirement till date, and therefore there is more need for the demonstration of safety, efficacy, and quality. And also the formulation with the fixed dose of phytoactive is very difficult, and particularly the phytoactive loaded nanocarrier, there is still complete absence of the guidelines, and the regulatory guidelines is still in development. So to overcome this, the gap can be bridged between the preclinical success and clinical implementation by developing robust in vivo models predictive of the human outcomes. This is the need of the hour. Unless and until the in vivo models that predicts the human outcomes are developed, it is not possible. Then greater number of clinical trials are required. Comprehensive clinical trials are required to prove the safety and efficacy of the phytoactives, and also the guidelines for ensuring affordability and scalability of the nanocarriers is important. So with all these discussions on the progress up till now in the herbs-based medicine, how the transformation is taking place from the simple herbal extracts to phytoactives, and what are the problems with the phytoactives, and how bridging or integrating phytoactives with nanocarriers can take the phytoactives to the next level. I conclude that although phytoactives have made success in the preclinical testing, a lot is required, that is exhaustive continuous clinical trials to demonstrate more safety and efficacy. If it is done, the phytoactives will do wonder, and with the quantum of the research work that is ongoing, I am very much confident that in coming days you will see more successful phytoactives loaded nanocarriers on market for treatment of cancers. So with this I end my talk, and the session is open for question and answer.
Thank you, ma'am, for considering us. Actually, session was already late by our previous session. That's why we told ma'am to please summarize your session. So sorry for that, ma'am.
There were some details about the recent development that
definitely,
I could not take up. I understand.
No, it's okay, ma'am.
Time issue.
We can consider. So any question, any queries? Anyone? Session is open for all. Sir.
Those students who are in research doing MPharm or PhD, they can ask question on how to take it up.
Okay, very good afternoon to all of you. Very good afternoon. I know it's lunch time, high time, yes? Okay. Wait for 5 to 10 minutes. Today I am very fortunate and very happy to chair the session of my teacher, Dr. Shagupta Khan Madam. Basically, it's not like a session, it's like a class. We all are seated in the classroom, and Madam teaches us about all these things. So, as I know Madam, so Madam is very hard worker and very sincere in her any kind of work. So ये सभी चीज़ें आपको ये सेशन में दिखी हुई है. Let's me explain in a short manner. As a title of conference, natural to synthetic. So considering that title, Madam also explain how you can convert phytomedicine, or you can say a plant containing phytoconstituent, and convert it into a nano carriers or nano formulation. So Madam started her lecture or her session. As you remember the first slide is related to the conventional and targeted. That is the first slide. I remember very much because I seated there as a student, okay? So, so considering the first slide, how, what are the drawbacks of conventional method and what are the positives of the targeted delivery, and considering that several plants have a different kind of the activity. Madam generally focus on the such phytoconstituent related plants which having an anti-cancer activity. So the initially we have to search particular plants which having a particular activity that you have to consider, and then you have to extract that plant. Means after extraction, as madam also told, what are the drawbacks of the extract that you are used. So again you have to carry out the isolation so that you can get a different phytoconstituent, and you know that the phytoconstituent have a therapeutic activity, and then that phytoconstituent you can convert into a particular nano formulation, that may be a liposomes, that may be whatever, any kind of the nano formulation or nanoparticle. But again, after the isolation of that phytoconstituent, it having again the same some problems like pharmacokinetic properties and physicochemical properties. So you have to improve its solubility, you have to improve its viability, and so many factors associated to that. So accordingly, you have to carry out or you have to convert that particular phytoconstituent in a proper nano formulation. You can say a nanoparticle or liposomes. Then again, madam described the several case studies, different phytoconstituents like curcumin, resveratrol, quercetin. Number of phytoconstituents are there which are used as an anti-cancer drug, but that phytoconstituent having some problems, and therefore we have to overcome that problem so that our nano formulation may be a much more effective and showing a more therapeutic effect. So accordingly, that we have to carry out some modification in the liposome career, or you can say nano formulation career, or you can say again a different kind of the polymer you have to use, or you have to carry out some conjugation with the particular polymer, or you have to carry out some combination therapy. So adopting all this technology, you can increase or improve the therapeutic efficacy of that particular drug. Again, in the second last slide of the today's session, madam told you that there are a limited number of phytomedicines used nowadays. So you have a very good chance to work on it. You have to find out a particular career and develop it. There are again some limitations. We have some limitations related to the regulations and framework. So accordingly, that considering that, you have to carry out some formulations. So thank you so much, madam, for giving us knowledge regarding the phytochemicals, natural remedy, how it is useful for human being. I am also thankful to the principal, sir, Dr. Taukir, and all the faculty members for inviting me as a chairperson. And I'm also thankful to the student, all the delegates, all the participants seated here up to 2 p.m. Thank you so much.
Thank you, sir. Thank you, ma'am. Now, it's my honor to invite our respected principal, Dr. Sheikh, sir, to present a token of appreciation as a symbol of love and gratitude to Dr. Shagupta Khan, ma'am, Professor of Pharmaceutics at Institute of Pharmaceutical Education and Research, Varda. Thank you, sir. Thank you, ma'am. Also, I request our principal, Dr. Sheikh, sir, to present a token of appreciation as a symbol of love and gratitude to Dr. Atul Hemke, sir, Principal, Srimati Kishoritai Bhoyer College of Pharmacy, Gada, Nagpur. Thank you, sir. And also, I request our principal, sir, to present a token of appreciation as a symbol of love and gratitude to Dr. Sayyid Sajjad, sir, Principal, Central India College of Pharmacy. Thank you, sir.
All the students are requested to join for the lunch on ground floor. And staff and all teaching and non-teaching faculties are requested to join for the lunch on just opposite of our auditorium or outside of our auditorium. After lunch, just by 2:30, there will be evaluation started for poster and oral presentation. So please make it little fast. All are requested to please make it little fast.
Attention everyone, those delegates are failed to submit their posters are requested to kindly submit it.